must constantly look at things in a different way.
The Healthcare Education Transformation Podcast was created by two physical therapists out of the desire to learn more about the different educational roles in physical therapy and healthcare, and how healthcare education works by talking with educational leaders and people with different perspectives within physical therapy and across interdisciplinary lines on how education can be improved to disrupt the status quo of healthcare education. This is our journey, and thanks for listening. Are you a third-year physical therapy student that excels on tests when you have study guides, checklists, and deadlines? With all of the information available about how to prepare for the NPTE, it's easy to get disorganized and not feel prepared going into the big day. NPTE Prep Success is an online course that provides PT students easy-to-use study guides and step-by-step guidance through the NPTE preparation. To learn more, visit kylericeprep.com. Thank you again all for your continued support, and now for the show.
Hello, everyone, and welcome to another episode of the Healthcare Education Transformation Podcast. I'm your host, Stephanie Wyrock, and I'm joined by my fellow co-hosts, Brandon Poen and F. Scott Fiel. And today we have the esteemed pleasure of talking with Dr. Lisa Dorsey, and she is coming on the show today to talk about the American Council of Academic Physical Therapy, or ACAPT, Graduate Outcomes Task Force. She is the chair of this task force, so she knows a lot about this topic. Dr. Dorsey also holds the position of assistant professor in the Department of Physical Therapy and Athletic Training at the Dorsey College of Health Sciences at St. Louis University, and she's co-founder and president of Eloquencia Consulting, a holistic firm that supports professional development within organizations specifically focused on higher education. And she also just recently finished a tenure in her local community as the secretary for the Board of Education in the Melville School District. So she's very, very, very busy. Lisa, thank you for joining us on this podcast today.
Well, thank you for having me. I really appreciate the opportunity to chat this evening, and it's really terrific to be part of the podcast.
So you, obviously, I've known you for many years now, and I've admired everything that you've done, and we've had this conversation before, but for our listeners that maybe don't know about you or don't know a lot about your accomplishments, maybe give them some background about who you are and where you got to where you are today in your academic journey.
Okay, well, as you mentioned, one of my roles is a faculty member in the PT program at St. Louis University. I am also the president and co-founder of Eloquencia Consulting, which is a firm that works on primarily right now professional development of women in the workplace and establishing programs to support those kinds of initiatives. I have also served in a number of faculty positions and administrative roles. As you had kind of questioned, how did the journey begin? I actually look back to my clinical instructor days, which is really a lot of fun as a clinician to really be able to work with the very energetic students who are just, waiting to learn something new, and you see that early passion around physical therapy practice. And so I did that with a number of students. And once I finished my MBA, I was fortunate to join Washington University's physical therapy program as a lab assistant, and then moved up to, through the ranks, I should say, into a instructor position. And shortly after that time, my husband was transferred to Minnesota, which is probably the moment, I think, when my career was kind of catapulted forward. We found ourselves at the University of Minnesota, which is a very large public institution. And I had always said I wasn't going to go back to school unless I was in an environment where somebody was going to be, helping me financially. And lo and behold, I found myself in that environment and took full advantage of having the opportunity to become a faculty member at that institution for 10 years and be surrounded with the wealth of knowledge, not only by my PT faculty colleagues, but also just everybody on that campus, and succeeded in completing my PhD in educational policy and administration in higher education. And that just opened up so many doors and opportunities both within higher education and outside of higher education. And once I came back to St. Louis, I joined St. Louis University, which was my alma mater. I was here as an undergraduate PT student, so that does tell you, it dates me, I guess, a little bit. And I served as Associate Dean for Academic and Student Affairs for the Dorsey College of Health Sciences, and moved into the Dean's position, and then finally into an Associate Provost position for undergraduate education for the university at large. So those are a few of the areas that I've had some opportunities to grow within higher education.
Yeah, Lisa, that absolutely amazing journey. And, for our listeners who may be hearing this for the first time, could you maybe tell them what the American Council of Academic Physical Therapy, aka ACAPT, does?
Yeah, so, very simplistically put from my understanding is that ACAPT is an organization that is working to move the academic side of physical therapy education forward, and at the same time also looking at how are we developing leaders within the profession and moving physical therapists forward at the same time as we're looking at kind of what are the inputs and what are the outputs, and how are we all moving that profession forward.
Yeah, I think that's a really helpful take, because a while back we actually had Barb Sanders come on to kind of talk about an overview of ACAPT and kind of what they've been working on. And to be honest, that was really enlightening to kind of hear all the behind the scenes and how that's working. So I have tremendous respect for what ACAPT's working on, because I know they've got a lot going on and they're doing a lot of work.
I agree. I think it's a very dynamic organization. Absolutely.
Yeah, it really is. And there's so many things that they're doing in there. And of course, with our focus tonight is focusing on the Graduate Outcomes Task Force. And, per ACAPT's website stating that the goal of this task force is to make a recommendation to ACAPT on the feasibility of identifying a common standardized set of expected graduate outcomes that has the potential to be adopted by all programs. So before we kind of get into that, what are and were some of the problems with current DPT education that really prompted this task force, and how did this task force form, to kind of give some context to our listeners?
Yeah, it's a great question. And you guys have had the opportunity to speak to so many people within the profession that have also kind of highlighted the fact that as PT educators and as our PT profession at this point in time, we are many, but we are one, in that we have some inconsistencies, if you will, with regard to what those outcomes look like when you complete a PT program. Now, granted, of course, we have our CAPT guidelines and those core documents for APTA that all provide us that foundational knowledge and direction and where we're going. But I think there was some needs that had been identified that we needed to have that kind of consistent baseline outcome knowledge within PT education. And so ACAPT put out a query for those who might be interested in serving on this committee in like April of 2016. And when people applied to that particular ask, they chose individuals and put the task force together. And I can elaborate more on that if you'd like, or I'm not sure how much detail you want around that, but we just had a terrific task force.
Yeah, I think it'd be interesting to kind of hear a little bit of kind of how that was kind of formed, just because maybe if some of our listeners aren't kind of sure how something like that's put together, because I know some people might be thinking, well, how did this all come to be? I don't know if I trust that,
Sure. So again, we, it was a volitional opportunity, so we could apply if we were interested, and they chose a task force of 5. So it was really individuals who have experience within PT education, PT practice, et cetera, and had a passion around what the future of physical therapy education and practice was going to look like or could look like. And so it was myself and Terry Nordstrom and Nanette Highland and Sherry Roney Adams and Yasser Selim, and we all 5 came together and pulled from all of our backgrounds that experience and the literature and all of the processes and task forces, et cetera, that we'd all been involved in. We brought all of that to the task force, and then we cast a net that was even much larger than that and put it out to our colleagues and our peer professions, et cetera, and drew on all of that knowledge in addition to association knowledge and CAPT knowledge and federation knowledge, et cetera, and kind of brought all that together and had really robust and spirited and energizing conversations for a period of 6 months. And then we put together a final recommendation to the task force. They gave us a window of 6 months. So we started meeting in June of 2016. I was the chair of it, identified as the chair. And then we met every 2 weeks, I think, through December 2016. And that's when we actually submitted our final recommendation to the ACAPT board.
Did you guys collect any data? Did you make your recommendations based on data that you collected? And if so, how did you go about collecting it? And what did you learn from the data or the discussions that you had?
Yeah, that's a great question. So, data, that's a big word because when we set out to inform ourselves of, how do we tackle this large, very important topic to our profession as we move forward, we really discussed what are the resources and what are the sources that really were going to inform us the best in order to make the right recommendation. And so we really didn't have hard data from a numeric viewpoint. But what we did was we looked into the literature at our foundational documents. We looked into the literature at APTA Board of Directors documents where recommendations had been made relative to this topic. We looked at peer professions and other professions who had already established outcomes for their particular profession and what were they gaining from that. And I personally was the chair of implementing and assessing and revising our undergraduate student learning outcomes at an institutional level here at SLU. And so I kind of pulled from that information to say, how did that inform us as a group? So we brought all that together, not in a numeric sense, but in an informative sense of what worked when outcomes were established. How were those outcomes established for those particular professions? What were the challenges along the way that would help us keep in mind what kind of framework we would need to have in place if indeed the recommendation went forward to establish the outcomes? And so we pulled all that particular information together, and that's really kind of what informed us. And also the outcomes of other task forces and groups like the Excellence in PT Education Task Force, all of that kind of information. And that really informed us to come up with our final recommendation to the board. I think we reviewed about 99 different documents, and it was very exhaustive. So it was from medicine, and it was from nursing, and of course it was from PT, PT literature, APTA documents, CAPT, Federation. And as I said, we cast a very large net. We looked at vet med, we looked at public health, we looked at health sciences, athletic training, physician assistant. So we really looked at all of those areas and said, what are they doing? How has it been successful? What are the outcomes of their initiatives? And how does that help us as a physical therapy profession to determine which steps we take and what they would look like if we went down this road? And we found the most data, if you will, within medicine, within nursing, and within pharmacy. And medicine and pharmacy are now moving into the world of developing EPAs, or entrustable professional activities, which are those applied, if you will, activities from competencies or competency-based education that's then supervised by a mentor in the clinic or preceptor in the clinic, et cetera. So they're really moving into that particular realm of assessment in that clinical model. Actually, you guys may recall that last April, the education section sponsored the Entrustable Professional Activities lesson from medical education hosted by Dr. Gail Jensen, which was really informative to help us as physical therapists to start thinking about what those outcomes look like relative to that kind of competency-based education model and EPAs for physical therapy. And there's also some literature. Chesbrough et al. Has published a document looking at whether or not EPAs are right, if you will, or is the time right, et cetera, for physical therapy education. So those are a few areas that we looked at in order to make sure that we were representing our profession well in a real exhaustive sense of development.
Yeah, Lisa, we've had a couple of MDs who are also professors on the show before, and as well as some pharmacy students. And that seemed to be the growing trend, was that we're moving toward more experiential learning and more mentorship type stuff, and trying to get more out of the lecture-based learning. And it seems to have been working wonders, especially in the medical field. But when you guys were collecting all that data and kind of going through that process of 90 some odd articles and pieces of literature, what did you find to be some of the pros and cons of the method that the task force used in order to collect this data? Did you guys find anything that really worked for you guys in amassing all that, or were there barriers that you had to go through?
Yeah, that's a good question. Well, one of the challenges was making sure that we all felt comfortable as a group, that we really had done an exhaustive search, informing us as a task force and making the right final recommendations. So I think one of the challenges was just looking at all of the areas and finding the work within those particular areas that aligned with physical therapy and highlighting again, what worked and didn't work. And as I said, this task force was a terrific task force. We were all together almost every single time. We were just in unison in what we pulled from the literature and how we thought it actually applied to PT. So that was a pro. We pulled from our professional experience, which was fantastic. And we had a high level of diversity within all of our experiences that, again, was another pro that we could then apply to this particular learning process for us. So that was, those were the pros were that we had a lot of ability to bring to the task force. The pros were also the fact that we were able to find a tremendous amount of information that we could use in order to be able to develop a solid recommendation supported with evidence from many different angles and many different areas, as I said earlier, not only within physical therapy, but certainly external to physical therapy. Stephanie asked earlier about data, and one of the cons is that we didn't necessarily have numeric data in how successful their outcomes that they had established were in maybe measuring student learning. We did have some very specific pharmacy documents around their outcomes, but again, they were in the process of revising those outcomes when our task force was formed and meeting, and now they're starting to publish quite a bit of the literature around EPAs, just like medicine. So those were a few areas that were a little challenging.
I think that's really good to know, especially with all the really good pros of the task force. There's also kind of some limitations there to kind of give some context. And Lisa, I'm going to go back up a little bit and kind of go more on this EPA route here just for a minute here, because you had mentioned before that pharmacy and medicine are starting to implement that more, as you were kind of saying from what you had learned from regarding EPAs. But then you mentioned this Chesbrough et al. Article that kind of talked about EPAs also well in physical therapy. For our listeners who perhaps aren't aware of this article, do you think you could kind of briefly give some summary into what this article specifically said, and kind of what are your thoughts on what we should take away from it?
The Chesbrough article was, it's from 2018, and I believe the title is Entrustable Professional Activities as a Framework for Continued Professional Competencies Is Now the Time, and is in physical therapy. And so they kind of looked at the values of EPAs for physical therapy. And again, this is my summary of it, the values of EPAs for physical therapy relative to the literature and or data around medicine and pharmacy. And it kind of identified areas of, can the learner carry out the critical practice activities under the designated level of supervision. When we think about that EPA piece, that's some of the questions that they're asking whenever we look at the literature. And so, one of the things was identifying what's the importance of partnering with the profession to develop that valid patient-centered EPAs that meets the needs of society and the profession. Do we currently have the comprehensive assessment at graduation or competencies across the professional continuums? How are we as a profession looking at that notion, and do we have the measures in place in order to be able to do that or not? And that's kind of where I think medicine is taking that, kind of part of that theoretical competency base, and how does that then translate, if you will, into the practice piece in a more application perspective. And so that was kind of, my take on that article, was really looking at, do we have what we need, or are EPAs maybe an opportunity for physical therapy in order to kind of move in that same direction?
Gotcha. And I'm going to ask kind of a unique question on that one there, Lisa, just regarding the EPAs, because that's something that I don't think most of our listeners are aware of or perhaps heard of. Do you think that that's something that the PT profession will adopt with time?
Oh, well, that's a great question. That's a big question. The webinar that Dr. Jensen hosted, who is also one of the authors on the Chesbrough article, it is beginning to explore that very question. And I think we're so early in identifying kind of what that endpoint looks like for us. I don't know if EPAs are what PT needs. I think that there's some really good work that is going on in our PT education research right now. It's so dynamic. We have the 2 excellence articles, again, by Dr. Jensen et al., that are really informative about, where are we? What does excellence in PT education look like? How can that continue to inform us? How can we move forward in those areas, if that's, the area that we want to move forward in as a PT education program, in order to reach those excellence kind of metrics. And I think looking at that particular information, looking at all the changes that are around us in higher education, bringing in some of the recent Sarasoli lectures, like Dr. Jetty's lecture on flattening was amazing. And really just kind of thinking outside of the box of where we've been and where we can go. So I don't know that we know that answer yet. Again, I think that we are at a point where there's some really nice, solid educational research going on in our physical therapy education models that will continue to inform us of kind of really what path is appropriate for PT education. But I do think we're at a point where we're looking at that. We're willing to look at it and say, what is the right path? And if we do something that looks a little different, is it okay to do that? Looking at what those risks are and what the benefits are, and is now the time? And that data, that information is now, I think, at a point where it's starting to inform us as a profession of how we're going to move forward. I just don't know the answer. I don't know the end to the story yet, but I'm on the edge of my seat, and I'm hoping to be part of that, like all of us, right?
Wow, I think that these are really, really big ideas, Lisa, and I really appreciate you sharing kind of you think is going to happen to PT education with how the task recommending for ACAPT. My question is, you've read all these great articles, collected all this data through your experience and through the literature, but what are some of the unknowns and the limitations that the task force talked about in terms of what needs to be next as far as PT education goes regarding the standardized graduate outcomes?
So some of the areas that we've identified as a task force, if the decision is to move forward with identifying that common standardized set of expected graduate outcomes, some of the challenges lie kind of within the application of the current literature that's out there to physical therapy education, because we are all autonomous, if you will. We all have our profession-specific educational models for good reasons. We have a set of standards that we are trying to meet, and we are all training professionals in varied ways based on what the scope of practice is. And so we need to look at that particular literature and learn from it and identify what works for us, not just make assumptions that if it worked for this profession, it must work for ours. So I think that's a challenge. I think it'd be very important to make sure that all voices are heard within the profession. That the PT education piece is also about that clinical education piece, not just the didactic piece. What about the research piece? What about residencies, associations, chapters, academies? All of these communities, I think, need to kind of come together to identify what that final outcome looks like. And then it's a challenge to bring all of those parties together. I've done that again at an institutional level in a little bit smaller scale, of about 600 to 800 people versus all of those entities that I just named off would surely be many more people than that. So I think it's important to be able to identify the priorities of all those groups and make sure that we're bringing all of that together in a way that is represented at the very least adequately in order to inform what those outcomes would look like if that's the road that we choose to go down as a profession. So I think that's probably the biggest thing, is to make sure that we're bringing in all the voices and all of the stakeholders. And in addition, we also need to recognize that there are a lot of physical therapy programs nationally, and we do all have kind of our own autonomy as a educational program. And it's important to be able to continue to stay true to that individual program mission at the same time as we're coming together as a profession to determine what those outcomes might be.
So, Lisa, based on where the task force is and with all the data, kind of considering the pros and cons you just discussed, what's the task force recommendations to ACAPT on feasibility of identifying a common standardized set of expected graduate outcomes in DPT education?
Well, that's a great question. We submitted our document to the board, ACAPT board, in December of 2016, and it is actually on the website. And so, in general, what we had found was that it seems as though a common set of graduate outcomes for physical therapy could be developed based on all of the information that we found. And that information came to the board, and we're waiting for the board to kind of make a decision around those next steps. And so that we're just waiting to hear from ACAPT to determine what the second part of the charge looks like. Because the board has also entertained a number of other task force outcomes, like the ACAPT Student Readiness Task Force is another task force that was very, very busy. I think they even have a white paper that they were working on. Looking at kind of that information came forward at the same time our information came forward, and I think there were some other task forces that were also putting together some information. And so bringing all that information together, again, at the same time, we were looking at some significant contemporary literature pieces come forward with the Jensen articles around excellence in PT education. I think that they're looking at all of those pieces to pull them together to see what the next steps would be for a task force, whichever task force that is in the end, and how they integrate all of the information that they have been informed with into their next recommendation. So as I mentioned, our report is posted on ACAPT's website. And so, generally speaking, individuals could look at that and certainly see the details around what this task force presented to the board. But we're in a bit of a holding pattern in order to await what their kind of informed decision will be in the end.
Yeah, and Lisa, we'll link to all of the recommendations in the show notes. So if anybody wants to check out further details, they can do that there.
Yeah, and that sounds like, honestly, like an overwhelming amount of data to synthesize and to collaborate on. Like, I mean, you said 2016 there, and it's like 2018 now. I'm like, I can see how that can take a long time now, because that was kind of one of my thoughts earlier. I was like, why is it taking so long? I'm like, oh, that's why it probably takes so long.
Certainly. You will. And there was a tremendous amount of, as I mentioned, information that went into the document. But again, because of the group that we had, I mean, Terry Nordstrom was involved in the excellence articles with Gail Jensen. And so he brought a wealth of information from that perspective and the medical EPA perspective, along with, of course, everybody else on the task force. But it is a lot of information. And I know that that board of directors and all of the other individuals that are involved in that particular process are looking at all of that information with a very critical eye. It's, whatever the next step might be, it's a big step. I think for the PT profession, we just have a lot of very skilled, very well-educated individuals with significant years of practice, looking at those particular pieces in order to inform us best on what that next step is.
Yeah, no, I think that seems to make a lot of sense. And, Lisa, I know you were talking earlier about pharmacy and medicine, how they're going along the EPA route for more kind of their standardization of graduate outcomes. For other healthcare professions, for that matter, that perhaps have a standardized set of expected graduated outcomes. And I understand that it's going to be different and we shouldn't always compare to other professions because we're unique, but just to kind of give some context, to kind of see what other models are doing. For some of the other healthcare professions out there that have a unique standardized set of graduate outcomes, do you know what their outcomes are?
Well, I mean, I know I kind of have an idea of what pharmacies was before they revised them. I'm not exactly sure how they revised them whenever they did, because I'm not privy necessarily to that information now that our task force is in a holding pattern. But, some of their educational outcomes were centered around the foundational knowledge, essentials for patient and for practice and care, medication use systems. So in pharmacy, obviously their outcome buckets look a little different, but again, it's around those foundational pieces of their profession. And I believe they've revised them. And I know there is a pretty significant body of literature at this point around EPAs for pharmacy. And so I'm not 100% sure how they're bridging that gap. I'm wondering if maybe the translation is that these particular outcomes and or competencies are, they're looking at how can we translate that into the practice model. And when we have a preceptor who's supervising, how do we know that those kind of, again, those more theoretical competencies that we may lecture on and teach, how are they being carried out in the clinic? And so unfortunately, I don't know a whole lot more about pharmacy's outcomes other than that, or how I know that they're looking at the EPA piece. I don't know that they've really moved to that particular model yet.
That's one thing that I've always found interesting about research, whether it be educational research or scientific research, is the translational component of how do you apply research to practice. And that is definitely very, very challenging. And kind of going off of that, I know that there are other task force that ACAPT has going right now to try to improve DPT education. Do you know, or could you give our readers just an idea of potentially what other task force ACAPT has going to try to improve education within physical therapy?
Well, one of the task forces that we have kind of joined with in a bit of this holding pattern is the ACAPT Student Readiness Task Force. And that is the primary task force, I would say, that we've kind of aligned with within the ACAPT charge model. Other than that, I believe there's a clinical readiness, but beyond that, I must say, I know there are a number of them, but I haven't really been involved with any really beyond kind of our initial charge and the alignment with the ACAPT Student Readiness Task Force. But I know that there are a number of them.
Hey, everybody. Thank you for listening to the Healthcare Education Transformation Podcast, as we greatly appreciate your support to help us advance healthcare education. We are very happy to announce that we have created a new tool to help develop clinicians into better experts. With that being said, we have created the HET Lite tool, which Lite stands for Learning, integrated towards expertise. And what we've done is we've taken our first year's worth of episodes with experts in the fields of healthcare and education, and we've taken one golden nugget or theory on expertise and presented it to you in a very easily consumable format so that people can take one lesson or nugget per week and map out and plan how to incorporate it into your clinical and educational practices. And by the end of the year, we think you'll be pleasantly surprised at how far you've progressed towards becoming an expert. To find out more, please check it out at pteducator.com/HET, which is also available in our show notes. Thank you again all for your continued support. Thank you for attending class today, and we hope that you learned something and gained value from the content.
If you'd like to schedule office hours with us, feel free to add us on Twitter at HET Podcast, on Instagram, HET Podcast, on Facebook, the Healthcare Education Transformation Podcast, and the homepage, healthcareeducationtransformationpodcast.com.
And for those of you following along in the syllabus, extra credit can be obtained by liking us, sharing us, and leaving a review.
Let's continue our journey up Mount Educational Success as lifelong learners.